mid-1980s, after decades of conflict left Vietnam in ruins, a massive political, economic, and social overhaul known as đổi mới ushered in greater opportunities for private investment and a loosening of the previously centrally controlled economy. This began an explosion of commerce, a rapid increase in gross domestic product, and a greater reliance on the private sector as an engine of growth. These changes had unintended side effects, among them a decline in an already basic low quality of healthcare for poor and rural Vietnamese. Higher education faced similar challenges, with crumbling infrastructure and an outdated system of learning in provincial and regional universities. In 1998, Chuck Feeney visited Vietnam for the first time.
The world is full of a lot of people who have less than they need, and each time you can address their problem, you help them to move forward and to feel that life can change and I can change it.
By working locally, regionally, and nationally, Atlantic began to help transform Vietnam's higher education and healthcare system. Early grants went to both hospitals and universities, with the majority of grant-making between 1998 and 2005 focused on higher education. The largest and most dramatic Atlantic investment in higher education went to the creation of the first 100% foreign-owned university in Vietnam, a branch of RMIT, the Royal Melbourne Institute of Technology in Ho Chi Minh City.
One of the first things we did in Vietnam was a university, and from a green field we had 5,000 students walking in and out of the doors. And that has continued on, and the country has expanded the universities in other parts of Vietnam.
What you see today in this campus is a wonderful facility that is of international standards. And that wouldn't have come about if we hadn't had that partnership with Atlantic, which I think has delivered and certainly has provided an indelible mark in terms of what has been done in the education sector in Vietnam. But also lasting change, I think, going to the future.
In Da Nang, Hue, Cần Thơ, and Thái Nguyên provinces, grants from Atlantic were invested to improve higher education facilities. A major focus was turning traditional libraries into learning resource centers. A learning resource center is an expanded model of the university library, incorporating computer and telecommunication centers, meeting and conference facilities, language labs, and other accommodations for advanced learning, teamwork, and research. In the healthcare sector, the need for structural assistance made an immediate impression on Chuck Feeney as he was taken on a tour of hospitals in his first visit to the country.
Chuck's want to really look at improving healthcare services in hospitals, because that's what he saw was needing at the time. Especially these tertiary care hospitals, where you see overcrowding, you see crumbling buildings, you see lack of equipment, you see people sleeping on the ground, and then just the whole mess.
As Atlantic learned more about the fundamentals of public health in Vietnam, it became clear that along with upgrading and building healthcare facilities, instilling a culture of public health was critical as well.
The public health deans were telling us, if you're interested in improving health and having an effective impact in a modest period of time, address injury prevention. A bit of a surprise, especially if you're used to building hospitals to deliver hospital-type care. You're probably seeing a lot of injuries coming into the emergency room, but the root cause of that is traffic patterns, traffic safety, and prevention helmets would be a very important part of that.
Atlantic grantees worked for many years to get a national helmet law passed. It has saved thousands of lives per year and reduced debilitating brain injuries significantly since 2007. Atlantic also recognized that tobacco is one of the main causes of disability and deaths in Vietnam. Working with government and non-governmental institutions, Atlantic has successfully funded a comprehensive strategy to improve tobacco control through legislation and communication campaigns. Major grants also were approved to build capacities for important national institutions such as the National Hospital of Pediatrics and the Hanoi School of Public Health. The plan for the National Hospital of Pediatrics was to build an internationally recognized center of excellence and a standard setter for pediatric care throughout the country. At Hue Central Hospital, Atlantic funded the creation of a new cardiology center that quickly moved to the forefront of heart surgery in Vietnam.
Đây là một cái công trình hoàn chỉnh đầu tiên về mô hình về trung tâm tim mạch tại Việt Nam. The first model cardiac center in Vietnam. Và dấu ấn tốt nhưng quan trọng hàng đầu đối với trung tâm tim mạch. Thì chúng tôi thực hiện một cái ca ghép tim đầu tiên ở Việt Nam.
In the provinces, the emphasis on primary care took Atlantic into the commune health centers, which was an important place of entry for healthcare. There was a significant amount of work to be done because the structures were dilapidated.
It became clear to us, though, that to be effective in delivering health services, we were going to have to address the health system and emphasize opportunities to get those health services out into the community and focus on primary care. And so the development of community-based health centers in Vietnam was kind of a marriage of the two, creating some facilities that would house the delivery of community-based primary care services, a marriage of our predilection for bricks and mortar with our focus on human resources and community-based primary care.
Together with the provincial government, Atlantic helped to fund the construction of more than 800 commune health centers in 8 provinces with a population of 8 million people with a total investment of more than $80 million. The goal was to create an integrated model from rural commune health centers to urban hospitals, with the hope that the government would implement this model in other provinces.
Nói đơn giản như vậy, trong lĩnh vực chăm sóc sức khỏe ban đầu, chúng tôi có những dự án nâng cấp cơ sở, trạm y tế, trang thiết bị cho cơ sở đó. Ngoài ra chúng tôi có những cái hỗ trợ để nâng cao năng lực của cán bộ y tế công tác tại tuyến cơ sở. Tại vì người ta phải có nâng cao năng lực như vậy, người ta mới có thể sử dụng những cái phương tiện vật chất và trình độ của họ có cao như vậy thì họ mới có thể nâng cao cái chất lượng chăm sóc sức khỏe cho người dân địa phương. Đó là một việc.
Since 1997, Atlantic Philanthropies has invested $381.8 million in improving higher education, public health, and primary health care in Vietnam. Since 2003, the focus of the grants has been on improving the primary healthcare system while instilling a culture of public health nationwide. And what are some of the outcomes? Fewer deaths due to motorbike accidents, better functioning hospitals with improved patient care, 6 modern collegiate libraries, and, at a particular point in time, 800 community-based primary care centers, 10,000 open heart surgeries, and 15,000 cardiovascular interventions.